Hi, and welcome to the informational video webinar series on the rules for certified school-age childcare centers. This is video number 5 covering policies, emergency preparedness, items available to view, and notifications. My name is Christina Christian. I work for the Office of Childcare as a regional manager in the Tualatin Field Office. The Office of Childcare hopes that you find these videos informative and supportive in learning about the new school-age certified childcare rule set. During each video in the series, we will explain some of the key features and highlights of the school-age center rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the School-Age Center Rule Book for the full list of requirements and rules. Okay, let's get started. Policies. A school-age center must have written policies identified in rules and provide them to staff and volunteers at the time of hire and when policies change, and parents and families at the time of a child's enrollment and when policies change. The Office of Child Care can provide you with a full list of the policies as stated in the Rulebook Policies section. The list of policies is a technical assistance document that you can request from your licensing specialist. It will also be available on our website. Each school-age program should review the full list and make sure they have written policies for each of the listed topics. Covering policies in staff, volunteer, and parent handbooks will make it much easier for everyone to review and refer to later. This is an example of the technical assistance document that was mentioned on the previous slide. It lists the required policies for the school-age certified childcare centers. It has been organized and formatted in a way that you can use it as a checklist as well. Some of the policies on the list include the following: safety measures, including injury prevention, the use of pesticides and other potentially toxic substances, animals or pets that may be on site, water activities, and prohibited substances and weapons. Center-sponsored religious and cultural activities, if any, including how holidays will be recognized. This specific policy supports transparent communication between the program and families. When parents know more about the program's activities and celebrations, they can decide whether the program is a good fit for their family. Communication methods and notifications, including how parent grievances, questions, or concerns are managed by the center, and a plan to ensure safety of the children who are using the restroom or completing a task separate from the larger group without direct supervision. Something new under the policy section is that a school-age child care center must have a policy regarding the storage of and access to inhalers and epinephrine for children who are permitted to carry or self-administer these medications. Emergency medication may not be stored in the child's personal belongings while inside the facility unless the center obtains written parent consent to permit children who have asthma to carry their own inhalers, or children who are at risk of anaphylaxis to carry their own epinephrine and use them as directed. Arrival and departure policies. A school-age child care center may only release a child to a parent or another person named and identified by the parent or parents of the child. A person picking up the child must show identification if they are not known to the center staff. If a child has parental permission To arrive or depart on their own, a staff member must sign the child in or out as appropriate. Please also see the parental permissions section in the rulebook. Emergency preparedness and response. A school-age center must have a written plan for emergency preparedness that addresses evacuation, relocation, shelter in place, and lockdown procedures, and responds to medical emergencies and other incidents that center staff will follow unless otherwise instructed by emergency personnel. This written emergency plan will include responding to health and safety emergencies or suspected abuse of children, staff, volunteers, or family members occurring while they are on center premises. Evacuating children to a designated safe area or relocating children to an alternate shelter. Designated safe areas and alternate shelters must be a minimum of 50 feet from the building being evacuated. A new aspect regarding emergency plans is how a school-age center will observe weather conditions and other possible hazards to take appropriate action for the children's health and safety. Conditions include, but are not limited to, the following: heat in excess of 100 degrees Fahrenheit or pursuant to the advice of the local authority, cold less than 20 degrees Fahrenheit or pursuant to advice of the local authority, a lightning storm, tornado, hurricane, or flooding if there is immediate or likely danger, an earthquake, air quality emergency ordered by a local, state, or federal authority on air quality or public health, and lockdown notification ordered by a public safety authority and other similar incidents. It's important that childcare programs have a plan for emergency situations. Include in your plan where to find this information in your area, what action or actions you will take, and how you will plan to keep parents informed. There is a new aspect regarding emergency drills. An emergency evacuation drill must be conducted within the first 10 days of the school year or within the first 10 operating days after initial licensure if the program is not operating at the beginning of the school year. This will ensure that children and staff are prepared for an emergency right from the start. Emergency light source. A school-age center must have a portable emergency light source, such as a flashlight, in working condition and available in each classroom or area used by children, the center's kitchen, and the center's office if applicable. A cell phone flashlight can be used to meet this requirement. A school-age center must have an emergency supply kit in a location that is known to all staff. At a minimum, supplies must include the following: first aid supplies, hand sanitizer, wet wipes and tissue, a whistle or air horn, a working flashlight and spare batteries, and a battery or solar-powered radio. If the program is located inside of a school building and the school has an emergency supply kit that program staff are able to access, this can meet the requirement. Items available to view. A school-age center must have specific items available in an easily seen and frequently visited location for families and the public to view. This can be met by a bulletin board located in the entryway. It can also be met by items stored in a binder that is available for parents and families to view. Typically, a great option for locating the binder would be near where parents sign their children in and out, as long as the items are available and easy to view. Let's review the items that must be available for parents to view. They are as follows: the most current license certificate issued by the Office of Child Care, all serious valid complaints and serious noncompliance letters for 12 calendar months from the date of the letter, a notice that the most recent Office of Child Care inspection and rules for certification of school-age child care centers are available upon request, the Early Learning Division website and phone number, and a statement advising parents and families that they can access information about their child care provider on the Child Care Safety Portal, the most recent water test results summary, information on how to report a complaint to the Office of Child Care regarding certification requirements, the Oregon Child Abuse and Neglect Hotline number and requirement to report suspected abuse or neglect, the program coordinator's full name, and at least one program leader who is responsible for the center if the program coordinator is not present at the center. When the individuals listed are not present, the appointed person in charge is identified in writing. A notice that custodial parents have access to all child care areas during the hours of operation and without advance notice. Center closures, such as vacation days and holidays. The dated current week's menu of all snacks and meals served by the center and substitutions recorded. A floor plan with primary and secondary evacuation routes from each area of the building posted on each floor, and a notice of planned field trips showing the date, times, and place of each excursion. The notice must be posted at least 48 hours in advance of the trip. Additionally, the following must be available to view. When on a neighborhood walk and all staff and children have left the premises, a notice with staff contact information and approximate return time. A notice when any child or staff member has a child care restricted disease as defined in Oregon Health Authority rule or food poisoning, and the center's behavior and guidance policy. The following items must be posted in each classroom or area used by children in a place where they can easily be seen unless the rule specifically states otherwise. Emergency numbers to include 911, where available, or local law enforcement, local mental health crisis line, fire department and ambulance service, the center name and address with main cross streets or directions to the center, child abuse reporting hotline, and poison control. Emergency evacuation procedures and an emergency evacuation and relocation diagram, including fire and weather-related evacuation routes near the entrance or exit of the room, the program daily schedule, the menu and children's dietary restrictions, known allergies, and nutrition requirements in a location easily accessible for staff, but not available to those who are not parents or guardians of the enrolled child. Rather than posting in a classroom, a school-age center may post this information in areas where food is served, and the applicable ratios and group sizes. Notifications. A school-age center must notify the Office of Child Care within 24 hours or by the next business day of the following items: a change of program coordinator, a change in mailing address when different from the physical address, a change in phone number, a known legal action or child abuse or neglect investigation, such as an arrest, criminal investigation or charge, or victim protection order involving any person for which a school-age center is required to request a background check, an unscheduled temporary or permanent center closure or relocation, any occurrence including a natural disaster that renders all or part of the school-age center unsafe or unsanitary for a child, including disruption of utilities or contaminated water. An incident that exposes children to an imminent risk of harm, such as a child leaving the center without the center's knowledge or being left alone on or off site or in a vehicle. An animal bite to an individual that occurs on site at any time or off site when participating in center activities. Additional circumstances for notifying the Office of Child Care within 24 hours include an accident involving transportation unless there were no injuries and only minor damage to the vehicles, any serious injury or incident involving a child who was given the incorrect dosage of any medication, a child who took or received another person's medication, the death of a child or a staff member that occurred on the premises of the center. Final circumstances for notifying the Office of Child Care within 24 hours include other dangers or incidents requiring emergency response, such as a fire or temporarily relocating children, anytime prohibited discipline or prohibited actions occur, and any incident where physical restraint is used. Notifying the Office of Child Care of most of these incidents is not new, such as with serious injury of a child, but the time frame of reporting within 24 hours or by the next business day is new. Items that require a program notifies the Office of Child Care within 30 calendar days are as follows: an anticipated temporary or permanent center closing other than a scheduled closing like for summer break identified in center policy, an anticipated temporary or permanent change in location, an anticipated center change or alteration that impacts the amount of usable square footage or compliance with the requirements, and a change in center name. Mandated reporting, suspected child abuse or neglect. Any staff member who has reason to believe a child has been abused or neglected is required to report the matter immediately. Reporting to one of the following: Oregon Child Abuse Hotline, Department of Human Services Child Welfare, or a law enforcement agency. This requirement applies 24 hours a day. This requirement applies to any suspected physical, sexual, or emotional abuse, child neglect, child endangerment, or child exploitation, inappropriate sexual contact between two or more children, or attempted suicide or threats of suicide by a child. The Oregon Child Abuse Hotline number is 1-855-503-7233. Notifying Oregon Health Authority. A school age center must immediately notify the Oregon Health Authority of any known case or cases of a child care restricted disease for any individuals that are associated with the center. Restricted diseases for child care are defined by Oregon Health Authority administrative rules. A program can contact their local public health authority to make the report, or they can contact the Oregon Health Authority directly at 1-800-527-5772. Parent notifications. A school age center must immediately notify parents or an emergency contact if the parent cannot be reached and document if their child does not arrive on his or her own at the center as scheduled, such as when walking to the center, is not present at the pickup location as scheduled, is involved in an incident that placed the child at risk, such as being lost, missing, or left alone on a playground, a field trip, or on a vehicle, has experienced any suspected allergic reactions, as well as the ingestion of or contact with the problem food, even if a reaction did not occur, was not administered medication in accordance with directions, received emergency medication for a life-threatening condition such as epinephrine, sustains an injury that may need evaluation by a physician or any impact to a child's head, has been exposed to poison, is bitten by an animal when the skin is broken or when an evaluation by a physician may be needed, is separated from the group due to an illness, and is involved in an incident where physical restraint is used. Additional parent notification requirements. By the end of the business day, a school-age center must notify parents of the following: significant changes in their child's physical or emotional state, known minor injuries such as minor cuts, scratches, and bites from other children requiring first aid treatment by employees, if their child was unsupervised at school or another location where not picked up on time, illness or infestation symptoms that developed or changed, a child care restricted disease exposure from staff or another child, administration of medication for a non-life-threatening condition that is only administered as needed, an animal bite to a child even when the skin is not broken, implemented emergency plans and procedures except for drills, and anticipated closure of the center. Thank you for watching. You can now move on to video 6 in the series.